Hi guys, we're back with sessions 27, and today we're going to address what's really important in the clinical setting. It's called your critical thinking. Now I know it seems overwhelming when you're brand new, but I'm going to offer you some helpful information that might make it easier. And actually there is a lot more on this topic. If you go to dearnurses.net, you'll find a topic called your critical thinking. I'm going to talk about putting the pieces of the puzzle together, stroke symptoms, and knowing what to do when an emergency happens in HIPAA. Let's first start with an overview of your critical thinking. I know this can be very challenging in the clinical setting, but here are some helpful hints about putting the pieces of the puzzle together. When you first take care of a patient, I know you may be confused about which order to put things in. Some of the most important pointers are you gather information, relevant information about the history of that patient, the diagnosis, knowing what is wrong. Is that patient on a fluid restriction? Do they have cardiac problems, renal problems? Because that'll all put a damper on how things are played out. Then you learn to familiarize yourself with the plan of care. Whatever the doctor orders for that patient, that's how you're going to assign your plan of care. Then you learn to delegate your responsibilities. You may not be the charge nurse, but if at any time you should be in charge and be placed in a situation of responsibility, you have a responsibility to designate to everyone, let everybody knows what that person is supposed to be doing. Then you know another thing you can do is your unit's policies and procedures. When you have the opportunity, familiarize yourself with your unit's policies and procedures. And of course, you assess your patient, also assess the family's needs. Some patients and families do have the need for social services and other situations as well, like they may even need clergy. Now, let's take the case of this nurse who has just arrived on scene. He is making rounds and finds this patient on assessment that she has slurry speech and a weak right arm. We know that this is very suggestive of a patient having stroke symptoms. So what would you do if you were put in that situation? Well, here are some helpful hints for you. Once you've established that that patient has slurry speech and a weak right arm, which was not the case before, get that patient back in bed, get some help, put that patient in a safe place, do an assessment, document what your findings, notify the doctor, and follow his instructions. And for more helpful information on that topic, please go to the Clinical Settings Step-by-Step, Chapter 18, and that will be on dearnurses.net. Then let's talk a little about the new nurse. I know it's very overwhelming being a new nurse, but you know what? We all had to start from somewhere. Let's take the case of John. He's new to the ER. There is a code situation. There is a patient having difficulty breathing, as you can see. People are gathered around the bedside. John is standing with his hand on the ventilator, just looking on. That's not good enough. You need to use your critical thinking. What can I do to help? Well, here are some of the things you might be able to do. You might be able to get the crash cart because you're going to need it if that patient is having difficulty breathing. Bring it close to the bedside, plug it in, get the backboard ready, check the patient's vital signs if they haven't been done already, because in a crisis, many people are running around, but sometimes people do forget to get an EKG strip, put it on the chart, make sure you put the name and the time. Check the IV bag and look and see if your IV fluids, is there enough IV fluid? Is there more solution available if that patient will be in need of more solutions? Take a look at the doctor's orders and see what might be needed, that you can get things available if they're needed. Another thing that people neglect to do is getting a trash can close to the bedside. And this is very important, because what are you going to do when they've opened dressings and packages and there's no place to dump the trash? So make sure you've got a couple of trash cans on hand. These are just small samples of things you might be able to do. If you go to dearnurses.net, you'll find a lot more helpful information on that topic. Let's take the case of this nurse. She's giving information, but to whom? She's giving information over the phone. Have you ever heard of that law, HIPAA, HIPAA? Health Insurance Portability Accountability Act. You have to be extremely careful in the clinical setting when you give information. To whom are you giving it? You might be giving it to neighbors, you might be giving it to an employer, or you might even be giving it to an attorney. So you need to follow your unit's instructions and policies as far as giving out the information for HIPAA, because it is the law. You need to check and find out if there's a special code word that you use, because every hospital addresses it in a different way. Find out what your policy is. And of course, like I said, stay posted for more helpful information, more clinical issues, and please visit dearnurses.net, as this will be very helpful in helping you with the topics we discussed. Have a great week.